speaker is Ms. Allison Kelly. Allison Kelly is the chief of the CDC Center for Global Health Workforce Management Office, just returned from the U.S. CDC in China after serving as Business Service Officer and Deputy Country Director for 3 years. Prior to her assignment to China, she served as a Strategy and Innovation Officer for the Coordination Office for Global Health at the Centers for Disease Control. Allison has been with the CDC for 20 years and has held management and policy positions across the Centers for Disease Control. In 2000, she served as the CDC Congressional Liaison. Truly an expert in global health care. Allison.
All right, I'm actually going to come up here. I'm used to actually presenting mostly at scientific conferences, and I'm always the odd person out because I don't use PowerPoints. So today, I'm going to use PowerPoint to be the odd one out that way, because I think there's a little bit of data that you guys might be interested in seeing. Or, you know, maybe you won't see it. Can I get this advanced? That looks good. Before I get started, one thing I would like to do is for all of you in the room who consider yourselves familiar with or expert in issues related to China and Chinese culture, I'd actually like you to write down my email address, because before I get off this podium, I'm going to ask you a question where you're going to try to crowdsource the answer to an epidemiologic problem that we have right now at the CDC. So my email address is ayk7@cdc.gov. And so make sure that I definitely ask you this question before I'm done. When the organizers asked me to talk, I was very excited to have the opportunities immediately upon my return to Atlanta to get connected with people who are really passionate about Asia. When they asked me, we had not yet heard of H7N9 influenza, which is now capturing a lot of attention in China and across the region. And that's just a good demonstration of why public health collaboration with China is really critical. But to really understand that issue, I'm going to ask that we sort of start here in the United States. And this data is a little bit old, but the general principles still hold true. If in the United States today we had a pandemic of influenza arrive, similar to the ones that happened during World War I, we would see 90 million people become ill. 45 million people would be treated outpatient, 9.9 would be hospitalized, 1.5 would require ICU care. We'd have over 700,000 people on mechanical ventilation, and probably 1.9 million people would die. So that's in the United States. Now I'd like you to think about China, where the population size is much larger, where people's healthcare seeking behavior means that they would be more concentrated at large hospitals, where there would be crowded conditions, where there's poor infection control and inadequate ventilation equipment. You can see that this could rapidly become a disaster of really large size. And that's one of the main challenges of working in public health in China. The challenge of scalability. China is just big. So for example, HIV, the prevalence of HIV in China is actually quite low, well under 2%, which is what we consider a generalized HIV epidemic. Yet, because the population is so large, that still means there's almost 800,000 people living with HIV in China. And in certain subpopulations in China, the prevalence is actually quite high. These dark red dots that you can see on this map of China is where the prevalence of HIV among injecting drug users exceeds 40%. So the numbers of people affected are actually quite large. There's a very big problem of complexity when you're dealing with public health. And in China, there's a number of man-made and natural environmental factors that make dealing with public health very, very difficult. This map shows countries which have been affected by the H5N1 influenza pandemic. And the dark red countries are those that are endemic. You can see that China is endemic for the largest country that is endemic for H5N1. The lines that go through this map are migratory bird routes. And you can see that they're very concentrated through the middle of China. China can't help that. There's nothing they can do to change migratory bird patterns. They're always going to be at risk for influenza. But at the same time, the Chinese are making huge changes to their environment through economic development that are also impacting the situation. Another challenge and complexity relates to sociocultural factors. I actually think these pictures are Vietnam, not China, but we'll pretend for a moment it's China because the situation is very similar. People live in close proximity to their livestock in these countries in Asia. So they have domesticated birds that are in contact with wild birds, and then they are in contact with their domesticated birds. Again, these sociocultural factors are very difficult to change. Another challenge of complexity is just the biology of disease, and this may look like a big mess to you, but basically this is the family tree of H1N1 influenza. And the thing to notice is that that influenza is made up of a lot of different strains that start in different places, and I'll just read to you some of the names of the places it started. Cambodia, Vietnam, Malaysia, Thailand, Hong Kong, Indonesia, Qinghai, Korea, Yunnan, Guangxi, and Guangdong. So again, because of these other factors, Asia is a hotbed for influenza activity. Now, there's also an increasing challenge of connectivity. This is a big issue for public health. So this slide takes you through the life history of patient A, who is an individual who lived in Guangdong province, who went to Hong Kong and spent the night in a hotel. While that individual was there, individuals B through K were also in the same hotel. Unfortunately, it turns out that individual A had SARS. And all these other individuals were exposed by that individual and very quickly disseminated across the world. So even though the SARS coronavirus has a relatively low transmission rate, it spread to 5 countries within 24 hours. And more than 30 countries on 6 continents in 6 months. And the population of China is increasingly mobile and moving around the world, so the potential for these problems increase. China itself lives in a very busy neighborhood. I always forget how many countries border China, and so I counted again. I came up with 14. I feel like I keep coming back and forth between 13 and 14. But they have a lot of border areas, and certainly right now North Korea is very much in the news. Afghanistan, Pakistan, all of these are places that present particular challenges in terms of working in public health, and they share the border now with China. In China particularly, there's a really big challenge around the issue of transparency. Today, as we speak, all infectious disease data in China is considered to be a state secret. So the culture is not to share information regarding disease. However, through some collaborative efforts of the US CDC and the China CDC has recently been designated the 5th World Health Organization Collaborating Center on Influenza Research and Reference. It's the only one that exists in the developing world, and I know you can debate whether China's developing, but let's for right now say that it is. There are a lot of requirements related to being a World Health Collaborating Center, including the fact that China now puts on their website in English every day their influenza data, so that everybody in the world can see it, even though officially it's still considered a state secret. And through this kind of information exchange, the Chinese response to H7N9 has been gaining incredible worldwide recognition and support. It's a very big change from the way that SARS was handled, where SARS circulated in China for at least 3 months before anybody said anything about it. And China, sometimes I feel like we pick on them, that we say that they're not transparent. They are also impacted when other people are not transparent. So China has not had an indigenous case of polio since 1994. And a lot of us encouraged China to try to reach out to some of the countries in the bordering areas that were struggling, including Pakistan at the time. So in 2011, China hosted a meeting of all its bordering countries to talk about polio and what could be done to support Pakistan. At the same time that the meeting was going on, there was actually an outbreak occurring in China's Xinjiang province that was an importation from Pakistan. Pakistan knew the outbreak was occurring in their own country and didn't share that information with China at the meeting. So transparency is a really big issue for everyone. The final challenge is that of complacency, and I was actually really glad to hear Mr. Jennings talk about the importance of keeping people healthy. A lot of people don't recognize that almost everywhere in the world now, the leading causes of death are non-communicable diseases, not infectious disease, but things that are more chronic, like cardiovascular disease and cancer. And that's true in China, too. In the top 10 causes of death in China, both in urban areas and in rural areas, infectious diseases ranks 8th. All of the other main top 10 causes of death are non-infectious. But currently in China, most of the money for public health still goes to infectious diseases, and the money from international organizations like US CDC often goes to infectious as well. So I don't want to end with too many challenges, although I've already got my signal that I need to end. So what I wanted to give you was with 3 opportunities that I think we have in terms of public health collaboration with China. There's public health opportunities, economic opportunities, and political opportunities. From the public health perspective, there's a lot that we can learn from and with China. They have been very successful in reducing a number of diseases at lower levels of economic development than any other country in the world. And they now have the capacity to do some very innovative, cutting-edge public health research that can then contribute to other countries who are facing similar epidemics. And China is beginning to emerge as a potential source for funding for public health work globally. In terms of economic opportunities, as I mentioned, particularly around the chronic diseases, there's a big opportunity for US businesses and healthcare systems in China. Tobacco cessation is a huge need. 67% of men smoke in China. And many of them have no access to any kinds of pharmaceutical or other types of quitting aids. So, I have a plan for every hospital in China to have at least 1 bar of soap. You would not believe it, but it's actually not the case, even in places where skin infections are a major cause of morbidity. And then finally, the political opportunity for the United States. Often there are difficult relations between China and the US, but health is somewhere where we both have the same goals. Healthy Americans, healthy Chinese, and a healthy world. So I got the red stop sign.